How I think about treatment failures in the injection, pain management, surgery type space. All right, we are on the curbside again for another episode of Curbside with the Doctor, and it is hot out today, so I'm going to keep this one a little bit shorter, but I want to talk for a second about how I think about treatment failures in the injection, pain management, surgery type space. And this is how I think about it. If somebody comes to me and they say that they had a cortisone injection for their low back, and they, when I find out more about it, I find out that they had this cortisone injection into their sacroiliac joint, as an example. If they saw no response from that, or if they just saw a very temporary, like a kind of 2 to 3 day, maybe a little bit shorter response that could be a systemic response to the steroids, then the first thing that I think of is that the diagnosis on the low back pain was incorrect. So if they were injecting the SI joint, the physician who was doing that was thinking that their pain is coming from their SI joint. And if they don't see a response, to me, it tells me that the SI joint is not a big contributor or cause from a tissue standpoint of their pain. Conversely, if somebody has, let's say, an epidural and they're just doing a lidocaine as an example, and there was no response, no improvement in pain, it tells me that the patient's pain is not coming from any structures that are directly treated with the epidural, which could be the discs and also could be the nerve roots that are coming out at that level. So the same thing applies to all the other areas. If you have chronic knee pain, even if you've been diagnosed with osteoarthritis, if you have chronic knee pain and you have an intra-articular injection of PRP, the PRP is put nowhere else other than intra-articular, and you have no improvement in your pain, it means that the structures that are intra-articular are not likely contributing to your pain, meaning the meniscus, the cartilage, the subchondral bone are not really contributing to your pain, and your pain is coming from something else. That's when it's time to really step back and evaluate what is going on, how can we provoke this pain, what can we do to bring this pain out with physical exams in order to have a better understanding of what is actually causing this pain. So, and one more example, because we're just going to give a bunch of examples to try and resonate with people, is a patient that I had recently where they were having neck pain, and under imaging, there was disc degeneration and foraminal stenosis, which basically means a narrowing of the canal that one of the nerve roots comes out of, and potentially pinching down on that nerve root. So the patient was recommended to have a transforaminal epidural, or basically an epidural into that foraminal space to try and relieve the pain coming from the nerve root, because this person had neck pain and their MRI imaging showed this finding. Well, the patient didn't get any better. The patient started working with me. I did PRP injections for the facet joints because on physical exam, her pain was worse with extension, better with flexion, which is generally characteristic of facet-mediated pain. And then all of our other facet-mediated tests were positive. So lateral flexion, aka when we compressed down the facet joint, increased pain. When we did Sperling's maneuver and Sperling's test, that recreated her pain. We treated the facet joints, and the pain after one PRP treatment 3 months later was about 60% better. So that is a great attestation to the fact that when you find the pain generator and you treat that appropriately with injections, that's where you can start to see responses. Just because you have something on imaging that shows something positive doesn't mean that's where the pain's coming from. And that first injection, she didn't get a response because it was not treating the structures that were contributing to her pain. So that's just how I think about failures in the injection space. And again, this also applies to surgery, right? If you have a surgery for a particular structure and that surgery does nothing for your pain, it's likely that that surgery didn't actually address the cause of your pain and try to actually hit at that. So just some things to think about as you are going through your chronic pain journey.